Bonding Protocol Introduction. Welcome to the Bonding Protocol module. What are the objectives of this presentation? Here it is important to understand the differences between conventional cementation and adhesive luting. The basic rules of adhesive cementation are taught here. Each individual ceramic material group has very specific conditioning requirements in preparation for adhesive cementation. These differences are explained in detail here. At the end of this presentation, you will be fully familiar with the clinical process of adhesive cementation and will be able to master it in everyday practice. Let's start with the theoretical background. The crucial difference between conventional cementation and adhesive luting is that only in adhesive luting is a chemical bond actually created between the tooth and the restoration by means of a composite. As can be seen in the scanning electron micrographs, this creates a gap-free bond between the two substrates. On the other hand, conventional cementation only works through mechanical retention. Ceramics, however, should not exhibit friction or mechanical retention, as this increases the risk of fracture. For this reason, adhesive cementation is absolutely necessary for the cementation of ceramic restorations, and conventional cementation is less suitable. Let's take a closer look at the mechanism of adhesive cementation. We want to achieve a chemical bond between different materials. On the one hand, we have the restorative material, in this case the ceramic, and on the other hand, the tooth with different substrates such as enamel, dentin, or even build-up filling. Basically, adhesive cementation works with two mechanisms. First, micromechanical retention is established by creating surface roughness. The second mechanism, the chemical bond, is then created by flowing a primer or an adhesive into these surface roughness. Special amphiphilic molecules contained in the primer or adhesive make a chemical bond between the hydrophilic dentin and the hydrophobic composite possible. What practical relevance does this theoretical background have for us? We need to know exactly the surfaces of the different substrates, and number one, we need to know how we can achieve micro roughness in these surfaces, and number two, we need to know exactly how we can create a chemical bond. With which substance is that possible? Let's look at the different materials and shed some light on how we can create micromechanical retention in these different materials. For us, basic tools for producing micro roughness are hydrofluoric acid, aluminium corundum for sandblasting, or phosphoric acid. Now let's take a look at which agent is suitable for which substrate in order to increase the surface area in this material by creating micro retentions. Hydrofluoric acid is a potent ore agent used to achieve micro roughness in glass. Therefore, hydrofluoric acid is the agent of choice for roughening the surface of silicate ceramics which contain a glass phase as an elementary component. Hydrofluoric acid has no effect on the surface of zirconium oxide and composites. Let us consider the process of sandblasting with aluminium oxide. This process is particularly well suited to adequately roughen the surfaces of zirconia and composites. Aluminium oxide particles are hurled onto the surfaces of the materials at a high pressure of approximately 1.5 bar, leaving a rough surface with optimal micro-retentions. Let's look at the effect of phosphoric acid. Phosphoric acid is suitable for etching enamel and dentin and therefore for creating micro-retention. It should be noted here that enamel is 95% anorganic and therefore requires a longer etching time. Dentine, on the other hand, has a much higher proportion of organic components and is only 70% anorganic and therefore requires a milder etching procedure and also a shorter exposure time of the etching. Namely, phosphoric acid should only act on dentin for a maximum of 15 seconds. Longer etching times on dentin can quickly lead to post-operative sensitivities. Finally, the collagen fiber network collapses and the micromechanical bond is reduced. In the case of enamel, over-etching is impossible. Even a longer exposure time to phosphoric acid only leads to a good retention pattern. Post-operative sensitivities do not occur with over-etching of enamel. Let us now shed light on the establishment of a chemical bond as the second mechanism of adhesive luting. Here it is now important with which substrate I can achieve this chemical bond. In this overview, it is shown that silan is suitable for creating a chemical bond to glass and to composite. On the other hand, the well-known MDP phosphate monomer is the suitable substrate to create a chemical bond with zirconium oxide, metal, dentine, and enamel. The surfaces of silicate ceramics and composites are silanized to create a bond to metacrylate group-bearing luting materials, such as composite cement in the context of the adhesive technique. During salinization of the silicate surface, a chemical bond between silan and ceramic is formed by the reaction of the methoxy group of the silan with the silicon oxide group of the ceramic. The necessary silan for the chemical compound is contained in different supplements. On the one hand, as silan or, as for example, with Clearfill Ceramic Primer Plus or Monobond Plus as a combination preparation. After the surface has been enlarged and micro roughnesses have been created, this silan is applied to the surface, where it acts for at least 60 seconds and then the silan is blown dry. The chemical bond to hydroxyl apatite in the dentin and enamel and to zirconium oxide and metal is created by the MDP monomer. The reactive phosphate group of the monomer establishes a very stable and water-insoluble chemical bond to the hydroxyl apatite crystals. The second reactive group of the MDP monomer is available for the polymerization reaction with the composite. The formation of a chemical bond to zircon functions similarly. Here, MDP is able to create a strong chemical bond through direct interaction with the zircon surface. This chemical bond is formed by the phosphate ester group of MDP. This theoretical background explains why zirconium restorations should never be cleaned with phosphoric acid. The phosphoric groups of the phosphoric acid occupy the reactive oxygen groups on the zirconium surface, which are then no longer available for the chemical bond to the MDP monomer. For this reason, zirconium surfaces should never be cleaned with phosphoric acid. They should be cleaned in an ultrasonic bath with alcohol or distilled water or with katana cleaner. In this table, we have once again summarized the key factors for a good adhesive bond on the different surfaces. The adhesive cementation procedure is now becoming increasingly easier thanks to combination preparations such as the universal adhesive Prime and Bond Active from Dentsply Sirona. Modern universal adhesives such as Prime and Bond Active are self-etching single bottle adhesives that form a chemical bond to enamel and dentin as well as to composite, zirconium and metal. Universal adhesives can be used for direct restorative therapy. They can be used to bond light cured veneers, and they can also be used to repair composite, ceramic or amalgam fillings. It is also possible to use a universal adhesive to seal the cavity floor before using amalgam as a filling material. Furthermore, sealing of a sensitive tooth surface is also possible. Another large and interesting field of application for us is the adhesive cementation of indirect restorations and also of endodontic posts. If endodontic posts are to be cemented with Prime and Bond and a dual curing cement, or Prime and Bond is to be used as a bonding agent for the application of a self-curing composite cement, then it is essential that Prime and Bond is mixed 1:1 with the Dentsply Sirona self-curing activator beforehand in order to ensure adequate dark curing. That is, in the absence of light. Let us now take a closer look at composites for adhesive cementation. Which luting composites are available? Basically, we distinguish between the conventional fully adhesive monomer-based composite cements and the self-adhesive composite cements. The self-adhesive composite cements all contain acid groups, and these can be of a different nature. On the one hand, they can be phosphate monomers, and on the other hand, they can be phosphoric metacrylates. All self-adhesive composite cements are dual curing. They have a high bonding strength, and the special advantage of these cements is that no further bonding agents are necessary to create a good adhesive bond between the tooth and the restoration. There are many materials on the market, including Calibra Universal from Dentsply Sirona, but also Panavia SA from Kurare Noritaka. Also available are SpeedChem Plus from the company Ivoclar Vivident or Relay X Ultimate from the company 3M. The conventional fully adhesive cements can be divided into three groups. Firstly, we have the purely chemical curing cements, which cure independently in the absence of light. Next, we have the dual curing cements, which on one hand are chemically curing and on the other hand are also activated by light. And lastly, we have purely light curing cements. Let's take a look at the differences in these groups. Basically, all three groups have very high bond values. That is, there is a very strong bond between the tooth and the restoration. All cements require additional bonding agents, and the color stability is good with all of them. It is particularly good with the purely light curing cements. Let's go into the individual groups again in more detail. The self-curing or purely chemical curing cements have their special field of application in natural indications. It cannot be assumed that adequate light curing of the cement can be guaranteed, such as in the adhesive cementation of glass fiber posts or root posts, but also in the adhesive cementation of a tie base, for example, a zircon crown. These are areas of application where self-curing resin cements are the material of choice. On the one hand, there is the multi-link hybrid abutment from the company Ivoclar Vivident, but also Panavia V5 in the color type opaque from the company Kurore Noritaka is a purely chemically curing composite material. Probably the most widely used group of fully adhesive composite cements are the dual curing composite cements. As already mentioned, they require additional bonding agents. These are common materials that we all know, such as Panavia V5 or Calibra Ceram, but also Variolink Aesthetic or Multilink. With these cements, the polymerization reaction is initiated by light, but dark curing in the absence of light also takes place here. This gives us the certainty in every clinical situation that even areas that cannot be reached by a light source will still cure adequately. This is the reason why, despite light curing, a certain waiting time should still be observed before the restoration is processed. The purely light curing cements are usually used for thin-walled restorations where aesthetics play an important role, and these cements are especially very color stable. Due to their application for highly aesthetic restorations, these purely light curing cements are available in many shades. Examples of purely light curing cements are Calibra Vanilla, but also Panavia V5 LC or Variolink Aesthetic LC. Let's take a quick look at temporary cementation. Here too, there is a highly aesthetic composite-based temporary luting cement from the company Ivoclar Vivident, which is of course eugenol-free, not to influence the subsequent adhesive bond. It is an aesthetic temporary luting material available in two shades. One is transparent and the other in shade A3. Now we will get into the practical cementation workflow in detail. To begin with, here are a few general recommendations. It is advisable always to stay in one adhesive system and not to mix systems. All systems are coordinated with their components, and they ensure that if you use these components from one system, you will get the best possible results from it. At the end of the day, many materials work. It's just important to actually know the materials that you're using very well and how to use them in the right way and indication. This is a very important factor in the success of adhesive luting. Keeping the procedure as simple as possible is the least error prone. And here's a little practical tip. It is always advisable to have a summary of the adhesive protocol to hand so that if in doubt, it is quick and easy to check again how to carry out each step. Now, let's go through the practical bonding protocol step by step. The first step is to clean the tooth, and this is always the same, regardless of the material used. When cleaning, care should be taken to use fluoride-free preparations, such as pumice stone or a fluoride-free polishing paste. Cleaning the tooth surface can also be done by sandblasting. Aluminium oxide powder with a grain size of 27 microns is usable for this. Another product that is suitable for cleaning teeth intraorally is the Katana cleaner from the company Kurore Noritaka. The MDP salts contained within thoroughly clean the tooth surface of protein residues. This prepares the tooth optimally for the subsequent adhesive bonding procedure. After cleaning, the tooth surface should be free of macroscopic impurities. Alcohol is not suitable for cleaning the tooth as it dehydrates the tooth's hard substance too much and therefore endangers the adhesive bonding. Hydrogen peroxide should also not be used for cleaning as it could disturb the subsequent chemical bond. The same applies to sodium hypochlorite. It should be mentioned at this point that prophylaxis sandblasting powders are not suitable for cleaning teeth before adhesive cementation. Special attention should be paid to the fact that dentin should never be dried too much. At this point, we would like to give a brief overview of the different adhesive systems. There are edge and rinse systems, self-etching systems, and universal adhesives. With edge and rinse systems, the phosphoric acid etching of enamel and dentin is done separately, as there are no acid groups in these systems. This means that these adhesives are not self-etching. Here, a distinction is made between two bottle systems, but also single bottle systems. In the two bottle systems, there is always a separate primer and a separate adhesive. With the one bottle system, the primer and the adhesive are in one bottle. The somewhat older self-etching systems contain acid groups and are therefore self-etching. In principle, these etching systems etch both enamel and dentin, but additional selective enamel etching with phosphoric acid leads to a better bond between composite cement and enamel. However, it is imperative to note that additional etching of dentin with phosphoric acid with these systems leads to over-etching of the dentin and should be avoided at all costs. Here too, there are single bottle systems and two bottle systems. Both variants contain a self-etching primer. In the two bottle system, the adhesive is in an extra bottle, and in the one bottle system, the adhesive is included in the bottle of the self-etching primer. The universal adhesives are always one bottle systems. They are self-etching and contain all the necessary components for a good attachment between the tooth and the composite material and other materials. The acid groups in these universal adhesives are much milder than the acids in the older self-etching systems. Additional etching of the enamel also leads to an increase in the bond strength values of the universal adhesives. However, the universal adhesives are characterized by the fact that the acid groups in these systems are much milder, and therefore an additional etching of dentin does not necessarily have such a strong negative effect as in the case with the self-etching systems. This makes the practical application of these universal adhesives much easier. The enamel can also be etched with phosphoric acid, and if some areas of the dentin are unintentionally etched in the practical workflow, this does not have a strong negative effect on the bonding between dentin and composite. It should be clearly stated once again that the additional etching of dentin should generally be avoided when using self-etching or universal adhesives. Therefore, in the practical workflow, enamel is always additionally etched with phosphoric acid, but strictly selectively. On enamel, the phosphoric acid is allowed to act for up to 45 seconds, after which it should be removed with plenty of water spray. After removal, the tooth should be dried out but not over-dried. Now the tooth is ready for the application of the universal adhesive. As mentioned earlier, dentin is very sensitive to over-etching. Therefore, the use of a universal adhesive is highly recommended. The adhesive is massaged onto the dentin and enamel according to the manufacturer's instructions, and then thoroughly blown with a moderate airstream until a glossy surface is left behind. If you use a non-self-etching primer, the tooth structure must be etched with phosphoric acid beforehand. Make sure that the dentin is in contact with the phosphoric acid for a maximum of 15 seconds before it is thoroughly removed with water spray and the tooth is dried. Afterwards, a non-etching multiple bottle system such as Syntac is usually applied step by step according to the manufacturer's instructions. It is essential to avoid over-etching the tooth, especially the dentin, to prevent over-drying, and it is important to adhere exactly to the application times according to the manufacturer's instructions. It is also important that no puddle is formed when applying the adhesive. That is, not too much adhesive should remain on the tooth after blowing. But also, the entire adhesive should not be removed from the tooth surface with too strong an airstream. Large construction composite fillings in teeth must be sandblasted to obtain micro-retentive surfaces. Aluminium oxide powder with a grain size of 27 to 50 microns should be used for this purpose. The chemical bond to composite surfaces is achieved by Sirona. Especially for the box elevation procedure, we strongly recommend the use of a sandblasting unit to ensure an adequate adhesive bonding to this filling. After the tooth has been cleaned, we now come to the cleaning of the indirect restoration. Basically, the cleaning of all materials can be done with a steam jet device or in alcohol in an ultrasonic bath. Cleaning with phosphoric acid is also recommended for silicate ceramics and composite-based materials. It is important to note that zirconia should never be cleaned with phosphoric acid. This leads to a deterioration of the adhesive bond. After cleaning, the ceramic is pre-treated. This procedure differs depending on the material used for the indirect restoration. For silicate ceramics, we obtain the necessary micro-retention on the surface of the material by applying 5% hydrofluoric acid. Subsequently, residues of the hydrofluoric acid are removed in a fresh alcohol ultrasonic bath, and the chemical bond is ensured by applying a sealant. Bonding. Slide 38. For zirconia, we achieve the necessary roughness of the surfaces by blasting with aluminium oxide powder. The particle size of aluminium corundum should be 50 microns, and the pressure applied should be 1 bar and not exceed this value. Afterwards, the restoration should be cleaned in a clean alcohol ultrasonic bath. The chemical bond is achieved by MDP. At this point, it should be noted again that MDP can be present in self-adhesive cements as well as in bonding agents used with conventional composite cements. The pre-treatment of hybrid ceramics depends on the main component of these materials. A composite matrix is pre-treated by sandblasting, and if glass phases are included, The surface can also be enlarged by the application of 5% hydrofluoric acid. With regard to the different materials, it should be noted that the manufacturer's instructions should be followed. After sandblasting or hydrofluoric acid pre-treatment, the indirect restoration is cleaned again in alcohol in an ultrasonic bath. The chemical bond to hybrid ceramics is usually achieved with silan. Let's summarize the workflow once again. Using Calibra Universal and Calibra Ceram as examples. The necessary materials for the workflow should be kept ready. On the one hand, we need a universal adhesive, and in this case, to stay in the system, prime and bond active. And the composite cement in this case is Calibra Universal, Calibra Ceram, or Calibra Veneer. We need hydrofluoric acid for silicate ceramics, phosphoric acid for silicate ceramic and tooth, and silan to make the adhesive bond to the material. Glycerine gel is needed, alcohol is needed, aluminium corundum is needed, and katana cleaner. We briefly repeat the cleaning of the tooth in the form of a table. Basically, the entire tooth is cleaned of impurities with a fluoride-free polishing paste or pumice. Large composite buildups should be sandblasted in any case. Then, selective enamel etching is carried out for approximately 45 seconds with a 36% phosphoric acid. Composites can also be additionally cleaned with phosphoric acid. Katana cleaner is then applied to the entire tooth for 10 seconds, followed by thorough rinsing and moderate drying of the tooth. If Calibra Universal is used, no additional bonding agent is needed. If we use Calibra Ceram as a fully adhesive composite cement, prime and bond active must be massaged onto the tooth surface for 20 seconds, then blown and light cured. Cleaning with a steam jet should always be carried out independently of the material. Likewise, cleaning in an alcohol ultrasonic bath. The pre-treatment of the indirect restorations follow according to the material. Zircon is then blasted with 1.5 bar and aluminium oxide powder with a grain size of 50 microns to adequately enlarge and prepare the surface. The restoration is then cleaned again in an alcohol bath. Katana cleaner can be used either additionally or after contamination of the restoration by saliva if sand is not blasted again. So the removal of saliva proteins can be done by katana cleaner as well as by sandblasting. It is important that all salivary proteins are removed from the surface of the restoration prior to adhesive cementation so that the adhesive bond can take place without interference. The chemical bond between zirconia and composite cement is achieved by MDP. MDP is contained in Monobond Plus or Clear Fill Ceramic Primer Plus. One of the two materials is applied to the restorative surface for 60 seconds and then blown dry. If the restoration is to be fixed with Calibra Universal, it is not absolutely necessary to create a rubber dam. If Calibra Ceramic, the fully adhesive resin cement, is used, the application of a rubber dam is recommended. Now the composite bonding material is placed into the restoration in as even a layer thickness as possible. The restoration is placed on the tooth and fixed. For the following 5 minutes, any movement should be prevented to avoid micro cracks in the cement. Composite and excess cement are light cured for 5 seconds, and then these cement residues can easily be removed. After removing the excess and an initial light curing, a glycerin gel is applied to the adhesive tube to reduce the oxygen inhibition layer at the interface. Now the cement joint is lightly cured further for 20 seconds, each of occlusal, buccal and oral. As mentioned earlier, the composite cement should be allowed 5 minutes to fully cure. Let us now discuss the bonding protocol for silicate ceramics. The pre-treatment of the restoration looks similar to the preparation for zirconia. That is, first the restoration is cleaned with a steam jet unit, then additionally cleaned and degreased in an ultrasonic alcohol bath. Now, phosphoric acid is applied to the restoration for additional cleaning. This should take effect for 30 seconds, is sprayed off with water spray, and the restoration is dried. We achieve micro-retention of silicate ceramics with the help of 5% hydrofluoric acid. This is applied to the adhesive surface of the restoration, and, depending on the material, there are different reaction times. For Celtra Duo or Tessera, use hydrofluoric acid for 30 seconds. For Ceric blocks or Emax, the times look slightly different. For Ceric blocks, the hydrofluoric acid should act for 60 seconds. For Emax, an exposure time of 20 seconds is sufficient. After the hydrofluoric acid has been rinsed off, the restoration is then cleaned again in an ultrasonic alcohol bath. Katana cleaner can also be applied at this point after contamination with saliva. In general, if a try-in is carried out after conditioning the restoration, it must be ensured that the restoration is then either treated again with hydrofluoric acid or Katana cleaner. These are used to remove the saliva proteins from the adhesive surfaces. Both are very effective for that issue. The bonding surfaces are now conditioned with the help of Calibra Silan or Monobond Plus. Silan is applied to the bonding surfaces, should be allowed to react for 60 seconds and is then blown dry. The same applies to silicate ceramics. When using Calibra Universal, rubber dam should not necessarily be laid, but if we use Calibra Ceram, the application of rubber dam is definitely recommended. Now the composite cement is placed in the restoration in as even a layer thickness as possible. The restoration is quickly placed on the tooth and clearly fixed and brought into the final position. Light cured for 5 seconds, and then the cement residues can be removed. We have a time window of about 45 seconds for this. After removing the coarse excess, a glycerin gel is applied to the adhesive joint, and then the restoration is thoroughly light cured again from all sides for 20 seconds. Once again, make sure that we keep a fixation time of 5 minutes to avoid microcracks in the composite cement. After the fixation time, the occlusion can be checked and the restoration can be finished. For the cementation of silicate ceramics, the use of Calibra Ceram or another fully adhesive composite cement is recommended. Hybrid ceramics should preferably be cemented with Calibra Ceram, that is, a fully adhesive composite cement. Here too, the use of rubber dam is recommended. The composite cement is applied to the adhesive surfaces of the restoration, and the restoration is placed on the tooth and fixed with strong pressure on it. Initial light curing of the composite excess takes place, and this can now be removed with good fixation of the restoration. When the coarse excess has been removed, a glycerine gel is applied to the bonding area and light curing is repeated from all sides for 20 seconds. A waiting time of 5 minutes must be observed. Afterwards, the restoration can be finished and polished. Thank you very much for your attention.